Hello, this is Dr. Lewerenz at Longevity Health Institute. Good afternoon. It's Monday, August 6th in the summer, and I hope you're enjoying your summer. I thought I would share with you another medical experience, and I actually promised a patient and their family that they were in this morning that I would talk about this topic because it so drastically affected them. And it's something that's underappreciated and also not diagnosed in their view, as efficiently as it should be, as they saw many specialists, and they just didn't get to the root issue or the cause. And so they sought our functional medical help and our insight. And as I think most of you already know, our toolbox tends to be a little bigger, and we start to think a little bit out of the box and take a little bit more functional wellness, integrative approach to medicine and to healthcare. But the condition that they wanted me to speak about and that I want to share with you, you may have friends or family or loved ones or heard a condition like this, but it's called chronic urticaria. And for lay or simple terms, it's basically like an internal allergy, if you will, histamine response out. And essentially, people will develop big, large reactions to their skin, hive-like, itching, red, burning skin. It can be their whole body, it could be their chest and neck and face. Typically, it will affect the upper trunk and their upper body and neck, but it could be their whole body. It's often brought on by stress responses or brought on by high temperatures and heat, so even sweating. So this individual who actually referred somebody else through some blog or some site that mentioned us, and we treated another patient with it. And unfortunately, their family sons have this condition, this chronic urticaria, because there is some genetic component and congenital component to it. But what it is essentially is a immune issue. And we tend to identify that it's a gut immune issue. So if we get to the root issue and the functionality of what's going on, we can actually get to the source and then to resolve it. Again, our minds here, and Dr. Lewerenz, my mind here, thinks very differently, and we think of why. I hate not knowing why something is happening. And so we look at what's going on in systems. One of the main systems that's affected with chronic urticaria is the autonomic nervous system. So anything that's affecting your autonomic nervous system, like stress, like decreased sleep, like infections, anxiety, things like this, play a huge component. So you have to appreciate the external effects of your autonomic response. The other thing that you have to appreciate is with chronic urticaria is someone's gut health, which is 70% of their immune response. So you have to look at their diet, you have to consider their diet, their inflammatory responses from foods, which commonly can be dairy and gluten and harder foods to digest, obviously sugars, nightshade vegetables. I could go on, but they have to be tested. And you have to take away some of the histamine responding foods and allergy producing foods, but you also have to fix then and restore their gut flora and their gut health and the binding of their barrier at the mucosal lining of the gut. Huge part of chronic urticaria and calming down somebody's histamine response and allergy response. Their individual story, as many with this, even though I don't have that many patients with it, but a couple handfuls, is usually pretty dramatic. Usually you can get near 100% resolution, but often at least an 80-90%, so that they continue to work out, because these are major effects. They can't exercise, sweat. If they're in the business world and in the world where they get often stress effects, to calm down this big response in their body, you need to really restore this. Otherwise, it just continues to suffer. But the other thing is that you have to remember that these often will lead into other immune issues, because when you're talking about your gut, it'll often lead into other allergy or immune issues later on. So we have to consider, like I said, stress responses, the autonomic nervous system, restore gut health. We also have to consider how the person detoxifies and if they have any toxins. But these have to be done in order, by the way. So you have to first restore gut health and diet, work on their autonomic stress responses and that in their nervous system, and then get their body and get their liver and their body to detoxify or identify if they have any toxic issues or poor detoxification. These are all can simply be done in a functional medical approach, and something that we do here at Longevity Health Institute every day. And there is hope with chronic urticaria. We do improve it and or solve it. In fact, these husband and son that I saw today, and they've sent me a few other patients with chronic urticaria, actually have had no symptoms, and I think over a year or two with work after we've fixed some of these systems. They work out, they sweat, they etc. They deal with one's in college, one's a executive, and they thrive and survive and are much healthier from an immune standpoint, and they've put at least to some degree, significant degree, chronic urticaria in the rearview mirror. So this is a troublesome condition. It is rare, but it's out there. If you need help with chronic urticaria or any allergy or immune or gut response, give us a try, look us up. Me and my practitioners are more than happy to help and to dig and divulge into your immune response and your immune system. So hopefully you found that enlightening and insightful. This is Dr. Lewerenz, Longevity Health Institute, Rochester, Michigan. Enjoy the rest of your summer. Be well.